Hi there, I'm Catherine from Arcadia Physiotherapy. This video is going to show you how to use a tennis ball to do back massage for yourself at home. I use this quite a lot with patients who have lower back pain, but it's also effective for the middle back and for the back of the shoulder, so rotator cuff injuries or stiffness or pain from desk posture. It's very, very simple, and I'll explain the process as I go through. Find yourself a tennis ball, one that's quite firm, not ones that are very squishy like a dog toy. Find yourself a decent tennis ball. Usually the number on it, the higher it is, the firmer it is. So this is an 800, which is perfectly good. The tennis ball is such a great size for all these little areas in your body that need a bit of massage but are too small for a foam roller, which is a bit too general. So the lower back, the glutes and so on, the back of the calf maybe. So I use them all the time and they're really effective. For the lower back then, you're looking at these muscles. The columns of muscle are either side of the spine and bones itself. So we don't work on the bones, we're working to the side of them. Taking the tennis ball, find your spine, and then move just to the side of it, into this sort of little niche here. Then you can rest yourself against the wall and against the wall. Keeping your upper body really relaxed, I often fold my arms or stick them in my pocket just to get them out of action. Often people end up kind of using their back to do the massage, whereas actually we want all this upper body relaxed. So, putting my hands in my pockets, folding them here, I'm just going to use my knees to massage my lower back muscles up and down the wall. I can add more pressure by moving my feet further away, or I can add less pressure if it's really tender, bringing my feet quite close. But again, just leaning in, and it's as if somebody is giving a nice, slow massage to your back muscles. You can go straight on, or you can turn sideways to get a little bit into that edge of the muscle here, which is often really tender where it attaches to the bony points. And I would recommend sort of 3 to 5 minutes of this each day or a couple of times a day, depending on your problem. Generally do both sides and you'll find that one side actually feels different from the other. But because it's the spine and the muscles on either side of the spine tend to interact with each other, it's worth just addressing both sides. Go to a point where you feel pressure, kind of therapeutic tenderness maybe, but not to the point where you feel like it's too much pressure or you feel that you're going to be sore the next day. This is about little and often. It's not about hammering it on in one go. The reason I do this in standing is because you can move up and down. Often I see people using it into their glutes as well, but I tend to do that on the floor. I've got a separate video for that, because when you're standing on one leg, or standing on your legs, your glutes will be activated slightly, and therefore you're sort of pressing the ball into muscles that already are activated and tense, and we don't want to be fighting one with the other. With the lower back, of course, to an extent you will be very slightly activated, but you can relax your upper body a bit more as your legs do the work. You can also do it further up your back. You can drop it down here or come up behind your ribs, and again, same process. And this is really, really nice for people who have upper back stiffness or pain, often from desk posture or lots of driving. And then for patients who have a bit of shoulder pain around the back here, it's often a useful way to get into those little muscles that stabilise the shoulder joint itself. So I hope that's been helpful. Thank you very much for watching. I'm Catherine, Arcadia Physiotherapy.